Welcome to the discussion on the Common Induction Standards. This forms part of our initial training for your induction into care. You're going to be an excellent social care worker, or as you call it in other regions, caregivers. Now, let's have a look at the role of the health and social care worker. And the way I'm going to deliver this program on this material is holistic. I'll mention a number of things which interlink in different standards. For example, communicate effectively. Some of the stuff, in fact, most of the stuff will be found in each and every component of the Common Induction Standards. Inclusion, safeguarding. But when I go to the major topics, I'll still mention what it is, but I want you to look at this holistically. If you can have in mind a triangle. At the top here, I've got the role of the health and social care worker. Here, I've got personal development. Here, I've got communicate effectively. So these triangles will be running through our theme until we go to the end of the program of Standard 8. So we'll be interlinking them. First of all, the role of the health and social care worker. The learning outcomes are as follows, which form as part of the main area. Responsibilities and limits of your relationship with an individual. 2, working in ways that are agreed with your employer. Number 3, the importance of working in partnership with others. Number 4, be able to handle information in agreed ways. And then we break those main learning outcomes into the actual finer details. For example, on number 1, the responsibilities and limits of your relationship with an individual. The finer details are learning outcome 1.1. Know your main responsibilities to an individual you support. The finer detail, learning outcome 1.2, be aware of ways in which your relationship with an individual must be different from other relationships. And then the additional information which you can refer to, an individual refers to anyone accessing care or support. It will usually mean the person or people supported by the worker. The worker, it is you who is giving the care, who is in the role as a health and social care worker. You are the worker, you are the carer. In that situation, already it points to you as a professional. Some of the care that you give might be in a residential home, some of it might be in a domiciliary care setting. In a domiciliary care setting, you are going to somebody's home or house where they live naturally, and it might even look like your own home. And this can create a lot of confusion for many care workers, because they are going to a house and it might appear as if it is just a normal house. No, for you, you are at work. You are a professional. You are actually going for work. And you must now begin to develop your skills after being trained and perceive every relationship you engage in as a professional relationship. You are giving care to the service user. So there mustn't be any confusion at all. Although you might see a house similar to any other house, that is your workplace. Now, what are your responsibilities? What are your responsibilities? First and foremost, you are responsible to provide care for the individual or individuals to which you're sent to, who are called service users. How would you know what kind of care you're going to give as a responsible carer? Beforehand, you'll be given information by your employer. It's part of their duty of care to be able to supply that information to you. and they will have recorded the information in what is known as the care plan. The care plan, in effect, constitutes a documentation that communicates information to you. And this links into Standard 3, communicate effectively and record keeping, as you will see later. That care plan has all the information about the service user. An assessment will have taken place beforehand so that a service user is provided with the right care. So your employers will have provided that information. And when you, as part of your responsibility, go to that home or house, you must check first and foremost what the care plan says. What is in the care plan? What is it that you're supposed to do? You're going to find those details in there. And each time you provide the care according to the care plan, you must in effect record what you've done as agreed. You must also record any changes you perceive. So that is part of your roles and responsibility. Some of the roles and responsibility that you might want to put into context is to ensure that the right care in the right context is provided to the service user. You may have to look at the values of care, the 8 values, which you're going to look at later on. This is very important. And then, in terms of your relationship with the service user, is purely professional. There are things that you are not allowed to do. These are your limits now. Number 1, touch. Number 2, hugs, kisses. Things that you may naturally do with your partner, you are not allowed to do with your service user. Secondly, the areas that only family members can do. For example, if you're not authorized to draw money from an account and buy stuff for your service user, you are not supposed to do that. There are special circumstances where a service user, a carer is authorized to do that. I'd like you to check at the time you're getting your contract with an employer or whoever is sending you out, check the details, the terms of agreement. Those things which are agreed constitute your responsibilities. It is also your responsibility to work in ways that are agreed with your employer. How are you going to ensure this? You must read your contract, as I said in the first part of our session. 2.1 outcome: be aware of the aims and objectives and values of the service in which you work. 2.2 understand why it's important to work in ways that are agreed with your employer. 2.3 know how to access full and up-to-date details of agreed ways of working relevant to your role. Now let's break them into pieces. Where are you going to find the aims and objectives and values of service in which you work? There is a code of practice and also your contract. These will have the aims and objectives. In fact, most care services in England, in fact all of them, are supposed to subscribe to CQC standards. There will be a general code of conduct. The employers, they must have their own a summarized code of conduct tailored to the environment, what you're supposed to be looking at really in terms of the source of information for agreed ways of working, and it'll give you a good guide. For every employer must have their own summarized versions from this umbrella body of conducts, which we have previously called the General Social Care Council. That's very important. Let's go back to the syllabus that we're looking at the moment and continue the discussions. So are we happy with that? And I hope you're making track of this. I'm giving you a general overview, and I'd like in your own free time to do more research on these aspects. So we are looking at the agreed ways of working as part of your responsibility as a caregiver or social care worker. Now, if I look critically at 2 point, where am I now? Sorry, I've just lost my page. 2.2, understand why it's important to work in ways that are agreed with your employer. In fact, one of the major reasons is that you will deliver according to the required standards. If you do your own stuff, your own thing, you'll be outside the legal requirement, and you're opening yourself up to unnecessary accusation and possible litigation, and also it may be harmful for the service user. So the agreed ways of working are critically important so that you may provide the care that is required to be received by the service user. And in fact, the policies which the employer has will also indicate the procedures that you follow. Sometimes you find that some companies are in their infancy, they're just developing. There are still some guidelines that they should be able to provide to you. And if they've passed their certification, they will have been exposed to the general code of practice. And then the importance of having you to work in the agreed ways with your employers is that you're actually performing according to the standards which are agreed. And also they'll be measurable for your progression. So we find that there's a wide range of things that you have got to take into consideration. So I would like you as a challenge to research and list some of the reasons why it's important to follow agreed ways of working. And some of the points are coming across the screen there. You can see the reasons why. Now, you should also know how to access full and up-to-date details of agreed ways of working. How do you do that? In the care setting, or like any employment sector, there is a hierarchy. You have a line manager who has a manager on top and the director. So if you're working below a line manager, that's the first port of call. Every so often, if your organization is properly run, they should have meetings regularly, maybe once every month, or as the case might be, to update you of any changes or anything that needs to be sort of put into context. Especially the care industry, there is a lot of dynamics. You should also be given information as a pointer where you can go and see this information, any changes. Go on the website, Skills for Care in the UK, CQC itself in the UK, and in the context where you are in your country, because I know care now is across the board, nationally, internationally. Go and look at systems, maybe your civic centers, where they post the regulations. Go and find out if there isn't, your staff must sit down and look at the human rights as well. Look at what sort of general guidance can be given to those who are looking after the community. Because I know some parts of Africa, some parts of the third world countries, even some of the first world countries are not fully developed like it's in the UK, where some regulations are in place. There must be some structure in which you can be sort of guided. It's important. So these are the ways in which you can get updates. But if we're focusing in England and Wales, it is very well developed. Materials are available. So your line manager must have copies. Let's also look at the next point, the importance of working in partnership with others. Caregiving is a multi-agency issue. How do we mean, or what we mean by this? Consider yourself as a center there. It is the service user. Then we have you, the service provider. Then we have the district nurses. We have the police. We have the council. We have all safeguarding bodies or other regulatory bodies. It escalates as it goes. And we have the family. So all these are different agencies. You are going to work with them hand in hand. Let's have a look at 3.1. Understand why it's important to work in partnership with carers, because there are other carers apart from you, families, advocates, and others who are significant to an individual, as I mentioned before, the district nurse or the GP, and as the case might be. 3.2, recognize why it's important to work in teams and in partnership, because we're going to talk about this holistically. And number 3, be aware of attitudes and ways of working that help improve partnership with others. Okay, let's go to the 3.1, and we can draw the links to the other learning outcomes under 3. When you go to work in the service user's home or house, the care plan itself is a focal point for communicating between different agencies. In the care plan, you notice that some information will be available to tell you who else is involved with the service user. It could be a family member. I remember one day I was doing an observation of my candidate. Each time he went there, he found that a family member had come and did certain things. For example, she would say, I've done A, B, C, D. Therefore, when the carer comes in there, he will begin on an aspect that is yet to be done. He won't repeat the same things which has been done by the family member. And after that, he also finishes another carer, because it's short shift, sometimes half an hour, sometimes 1 hour. So another carer would come and pick up where things were left off, or repeat the cycle if it says this must be repeated at 3, especially for those who are on medication, because that's another component. They are trained and they give at certain times, they record. So there is working together there. Now the importance of working together is that you will recognize the input of others so that you do not replicate what others have done, and you communicate there through the care plan effectively. And also, at the time you're picking up the job, they'll tell you who else is involved. So that's quite important. Sometimes it could be having to find out exactly what has changed. If you have got a consent and the right, you'd escalate to the manager to find out if there's any changes which haven't been updated. Sometimes things are missed out. You are supposed to put things right. So you find that also, apart from colleagues who work with you, the GPs or the district nurses will have things that they record in there, or things that are communicated to you via your manager, or sometimes directly if need be. It depends on how you have agreed to work with others. So as a team player, you must put into context other people's input. Otherwise, you find that you can repeat certain things which have been done already, or you might omit thinking another person has done it, which is why here, effective communication comes into place. Very critical, very important. Now, there are certain attitudes that can improve working partnership. If you have a right attitude to effective communication, you're going to work with others properly. If you can listen carefully to what others are saying, that attitude is important, because it will make sure that you receive the right information. And also, if you can pinpoint errors by way of escalating to the right agency, it can help safeguarding the service user. Mind you, this is about person-centered support. If you overlook errors which other people have done, you're actually creating an environment of propagation of errors which may harm the service user, and in the end yourself, because it might dent your own career. So working in the multi-agency aspect, it becomes important, and when you begin to point out certain working practices which are good, they can be enhanced. And if you point out working practices which are not good, they can be eliminated through training. It's not always that people are fired if they don't perform well. It's a matter of capacity building. So such an attitude is very important. And in fact, one of the things that I recommend is to have a post-it note or a little notebook in your pocket. When you're working, if you perceive certain things that are not actually usual to you and it requires you to go on for training, you record it. Or changes which requires you to have new knowledge, record it. Then go to your manager, be honest, say now, this has happened and I've noted that there's a new equipment as we were expecting, that the service user will be using a scooter or whatever the case might be, or a Zimmer frame. If you've never seen a Zimmer frame before and you don't know how it works, or even a wheelchair, just ask for you to be trained in that aspect. They can send you to some of the centers that are available or in-house training. So those are good attitudes. What I'd like you to do at this point in time is for you to make a list of your own attitudes that you can identify, which can improve working in partnership. You may pause the video and replay it once afterward. Thank you. We are going to end with 4. Number 4, it says, be able to handle information in agreed ways. Information is very essential in any setting. Now, 4.1, 4.2, 4.3, and 4.4, we're going to discuss this together and as holistic approach. 4.1 says, understand why it's important to have secure systems for record keeping and storing information. Remember, it's very important to keep information confidentially, and this actually is an act that must be followed. Legally speaking, you are not allowed to expose the service user's information to anybody outside your work environment and those agencies which you are working with. So this nails 4.1 because of Data Protection Act. In your workplace, there must be somewhere where certain information actually is locked with a key proper, and only certain people have access to those keys, because service user information is confidential. Be aware of how to keep records that are up to date, complete, accurate, and legible. How do you keep this? In every work environment, there is a format that you agreed with your employers and the service users. So follow that format. And once you follow that format and you update information on a regular basis as agreed, if they say update every week on a Friday or daily after work, do that. There are certain things that can be reassessed, the needs of a service user. Some employers do this every 6 months, or when they perceive a change. Or every 2 months they do a reassessment just in case things are changing rapidly. So now, the records you keep must be dated, signed by 2. Whoever is in charge of keeping records and validating, and the line manager. You sign when you finish work, if that's what's agreed. You sign off, today I've done this A, B, C, D, and I have not seen any changes in Mr. or Mrs. service user. You sign. The other person who comes, they can see your signature and the date and what you wrote. Now, there are those things that have to be changed. Only those people who are authorized, like your line manager and the directors, can do that. This is very important because the Data Protection Act 1998 regarding handling of information does actually say information must not be shared with anyone who is not authorized. Their level of authorization and escalation. So it's very important. And when you keep the information up to date and accurate, it's also good for the service user because they will receive, again I said, quality care and appropriate care. Because if things have changed, for example, on medication, the GP has recommended a higher dose or a lower dose, you must know that's been done and signed, and then you follow the right procedure. Be aware of, that's 4.3. Now be aware of agreed procedures for record keeping. What is a procedure in that workplace you follow for record keeping? From the care plan to other documents and in the office. Follow the procedures. Through training, we cannot tell you that this is one method and that's the only method. No, we can't do that. But what we tell you is that follow agreed procedures. When you're being given a job, or when you're given a job, at their own induction, administrative induction, they'll tell you how they keep records and stick to that. How they keep or record information, stick to that. How they store information, stick to that. It could be that, number one, they have a login system with your own password, you record information, only you have the password. Their own administrator who looks after the whole system has access to all the pieces of data for all staff. That could be one method, or it could be by hand and you log in a cabinet. Or it could be in a certain forms that you record, you leave them on the table, and somebody else picks them up and locks them up. Whatever method they tell you, that's what they follow. If it's legally approved, follow that. I don't think there's any employer who would ask you to record information publicly and leave it by the doorsteps. No, they can't do that. If you find anybody doing that, I think it's also your responsibility to escalate and make sure that it's corrected. Sharing information. What procedures exist in the workplace to share information? How do they share information? Is it through meetings? Is it through just the care plan? How do they do this? Find out the procedures. There must be standard procedures the employers have agreed. Sometimes they can give you a manual, a working manual, which they update every 6 months or every year, and maybe it could be electronic system like I mentioned before. So all these methods must be counter-checked to your agreement and the system they have set up already. What are these standards? It's also good to ask questions. Sometimes when you go for interviews, because the care industry can be so fast that even the employers themselves may not be aware that certain things have changed. But that would be an unfortunate situation. But if you are aware that certain things have changed, or they were announced yesterday, and you just go for interviews a day later, and there's no mention of that, you can ask questions. Because a proper interview, they should be able to say any questions. If they don't say, you can ask the question. Because, you talked about this code of conduct. Are you aware that yesterday they announced the new ones? Things like that. Be aware of how and to whom to report if you become aware that agreed procedures have not been allowed or followed, sorry. Whom do you report to? If, for example, you're working in a team, or even your manager, the manager themselves, or the case may be, who do you report to? Are you going to be a whistleblower? Or are you going to be somebody who is going to help the system to correct itself? The choice remains in your hands as you become aware of what should be done. Sometimes it's not good to be malicious. Be somebody who is an agent of development, an agent of improvement. Unless systems are not being changed, the case is different. So you should be aware. Normally there's a line of authority. There is you, there's your supervisor, there's a general line manager, then there's a overall a director, and then from beyond the director is external agencies. In the UK we have the CQC. Then you can escalate to those bodies, or it could be an area of safeguarding that needs to be brought in for training. There are materials that you can access from regulatory bodies. So it is really part of your role to research and have the right information. When you come on a training like this one, this is what we provoke in you, to become aware of how the system works. It becomes part of your duty of care as well. Your employer, some employers, in fact, most of them, they do send their staff out for training before they proceed for interviews in the next phase. They have phased interviews. They like your face, like your skills, then they say, okay, the last part, go and pass the common induction standards. Once you come through this program successfully, they take you on. But then when you go back to see them, you are a different person because you have now known more information than before. So you can be part of the improvement agency within your workplace. So it's very important. In summary, we have looked at different aspects of the role of the health and social care worker. And this is an overview. And I would like you, as you leave this training, to go and do more research on this. Do it religiously, research deeply, so that you can know the finer details. There are books that you can also read in the health and social care, I think the health and social care work level 2 QCF diplomas. They are available by certain providers. You can read those materials. In summary, I've looked at the responsibilities of the responsibilities and limits of your relationship with an individual. We have looked at you to demonstrate your main responsibilities to an individual you support. Be aware of ways in which your relationship with an individual must be different from other relationships. We say it's going to be professional. And in number 2, we said working in ways that are agreed with your employer. Be aware of the aims and objectives and values of the services in which you work. That's 2.1. And 2.2, understand why it's important to work in ways that are agreed with your employer. And 2.3, we said know how to access full and up-to-date details of agreed ways of working relevant to your role. Your line manager is that who are your employers. In fact, they give you the employer's handbook. Everything will be in there. And you find that policies in that handbook they give you will be recorded and will be very clear. Unless you don't understand them, you may ask. And also we looked at number 3, which is the importance of working in partnership with others, which are 3.1, understand why it's important to work in partnership with carers, that is your colleagues, families, advocates, which it could be lawyers or anybody who speaks on behalf of the service user, and others who are significant to the individual. We talked about the district nurses, GPs, or police, or the councils, etc. Also recognize, as 3.2, recognize why it's important to work in teams and in partnership with others. So you know what others have done, you may not repeat the same things they've done, or you just pick up the pieces where they've left off, communicated through the care plan and more. And 3.3, be aware of attitudes and ways of working that help improve partnership with others. The attitudes, especially record keeping, identifying areas of improvement through training, etc. Be able to, that's number 4, to handle information in agreed ways. And we said 4.1, understand why it's important to have secure systems for recording and storing information. Data Protection Act 1998. All information must be kept confidentially. Do not allow other people who are not supposed to see certain information about the service users to access it. Only within the realm of your workplace, and those people who are supposed to access it, like your colleagues that you work together with. Be aware of how to keep records that are up to date, complete, accurate, and legible. Legible, that's a point probably we didn't talk about. When you're writing with your hand, write clearly. Some handwriting is scribble, you can't read. It's important. By and large, look at the recording systems which the employers have provided for you to use, or to you to use. Number 4.3, be aware of agreed procedures for recording information, storing information, sharing information. They must provide you with the procedures they have agreed in the workplace. And the contract that you sign actually must include these things, so that when you begin to work, you must follow the accurate procedures. Now, sometimes these recording systems can be manual or electronic. Electronic with a password. Manual is ordinary books, but they are kept securely somewhere. Number 4.4, which is be aware of how and to whom to report if you become aware that agreed procedures have not been followed. Your line manager. Your line manager, there's a director. Beyond that, there's external bodies. So in your region, in your environment, see who are the external bodies and pertaining to what areas of a discussion or importance you're looking at. This is important. I'm so delighted that you have followed through this instructive program on the audio and also CD. This is an overview. It is a pointer to the training that you are going through. But for you to learn more, I want you to do a research in every area of what we discussed. And as we said, we're going to be dovetailing these programs into the role of this health and social care worker, effective communication and personal development. To research further, that is personal development. To make sure that you communicate very well, as we discussed, it's called effective communication. And it points into the role of the health and social care worker. Thank you very much. Signing off from Standard 1, it is your trainer, Dr. John Lukomona.